Okay, this is Dr. Hamilton, and we're going to go over 1 day post-op nasal surgery care today. So 1 day out, the first night you will have a little drip pad that you go home with, and usually wear that the first night, and by the next morning things usually have slowed down enough that you don't need that. But we're going to take that off, and there is a little piece of gauze inside each nostril. We've already taken one out, but they're very small. It's not a packing, and it comes out very easily. So very easy for that next morning. No packing like we used to have in the past. In terms of cleaning things, you'll want to clean 3 times a day with peroxide and Bacitracin, and we'll give you that. And for the peroxide, just take Q-tips with peroxide, and you don't want to go any further than the white part of the Q-tip, and you just make a little circle inside each nostril. And that's really where the sutures are all absorbable on the inside. Just inside, and making a little circle just like that. And then underneath here as well. I have a little crust out here we usually don't see, and we'll just take that away as well, and you can do that also. After we do the peroxide, we come back with usually Bacitracin ointment, and we usually give that to you after surgery. And we go over those same areas. Bacitracin on a Q-tip, just a little bit, going right inside, and again, making a little circle just like that. Don't want to go any further than the white part, and a little circle on the inside of the nose. And then one underneath. And of course, if we're heading back home, we'll put the drip pad back on here. Other things to think about this first week, and usually when you get home you can take this off. The drainage usually is slowed down enough from that first night that can come off. Other things to think about first 48 hours and first week, we have tape and splint on the nose, and that's going to stay on for a week. You want to keep that dry. Also want to do cold compresses as much as you can for the first 48 hours. And the nurses will show you how to do that after surgery. But it's just a wash rag folded into an upside down V over the eyes. And usually you can do this at home with a basin of ice water at the bedside. While one wash rag is on the eyes, the other is in the ice water, and just rotate every half hour. Keeping your head elevated for the first week, 30 degrees at least, is great. So if you have a recliner at home, that's a great way to keep your head elevated and yet still be comfortable. Don't want to blow your nose. If you have to sneeze with your mouth open, just because we want to keep pressure down inside the nose. You could actually blow air in those incisions underneath the skin. We don't want to do that. And then it's really hard to do, especially if you have an active life, but you want to really take it easy these first 2 weeks as much as you can. Of course, all those instructions are on your instruction sheets as well, but never hesitate to give us a call if you have other questions. So it's Dr. Hamilton talking about care after nose surgery. Thank you.